how concerned are you about that, and what's being done in terms of resourcing? Is there any pressure as a result?
There's absolutely no question that the hospital system is under enormous pressure across New South Wales, which is why we've had to take some measures that we've talked about in the past, so easing back on some of the not less urgent elective surgery. I think if you just take a look at, say, the St George situation, that was a case where we had a long-term cancer patient who became symptomatic and was tested positive for COVID. That caused obviously further testing of patients in that ward. The person who was in the ward in the room with that particular patient was also positive. They found another 2 cases across the ward, and there was a nurse unit manager and a junior medical officer who were also positive. The result of that, just in that one fairly small case, has taken out 80 health staff for the 14 days quarantine. So I think that's fairly indicative. I think a few days ago we were talking about the lady who became positive in the mental health ward. She was in, I've forgotten the date now, but I think it was about the 4th of August, but and a couple of days later she became febrile, had a temperature, and of course very thought disordered patients who need high levels of care with highly specialised medical staff, and that has caused pressures in that particular facility as well at Nepean Hospital. So look, it's fair to say that the health staff are doing an incredible job. I want to thank them. We're in the middle of a pandemic. That's not rocket science, and unfortunately a lot of our health staff are finding that they are on the receiving end of having to be taken offline because they are potentially exposed, not because they are exposed, but because they're potentially exposed, and some of them sadly have also been exposed. So that will continue. I just ask the community to be tolerant and understand that your nurses and your doctors and your physiotherapists and everybody else in the health system are working very hard for you, but we're in a pandemic and people will have to be taken offline, and we will have to have some inconvenience in that sense, but overall the health system is still extraordinarily good. We have 140,000 staff in the New South Wales health system. It's the biggest health system in the country. It deals with more patients than anybody else, so you'd expect that in the middle of a pandemic there would be cases that come into hospitals, and they'll continue to manage it extremely well, and I want to thank our staff. They are an amazing group of people, and every one of them deserves the very honest and complete thanks to the Minister and all of our community team.
Minister, Breast Screen New South Wales is closing.
Lucy first, then Anne, sorry. Lucy.
Breast Screen New South Wales is closing all of its clinics, it seems, across the state as of Thursday, I think. There's a lot of concern about that. Why is that a greater risk than going to the GP and indeed, retail stores that still remain open?
Look, these are obviously health issues, and it's a matter of weighing up the relative risk to patients and staff. Last year there was a period where right across the country breast screens were stopped for a period, and right now we're in the same situation. So the health staff who make these operational decisions have determined that's in the interest of everybody at the present time, staff and patients. But I've made it very clear to them that as soon as is possible, I would like to see that back. But on behalf of the community, I know we all want that back. But we also have a balancing act here, and I think it's not up to ministers or anybody else to tell the health staff how to manage what is a competing risks, if you like.